So I started my career way back in the late 80s as a entry-level radiation therapist and worked at the Cross Cancer Institute for a few years. And then I moved to British Columbia and I held a number of roles in British Columbia as a radiation therapist and as a supervising radiation therapist, and then went on to come back to Alberta, where I held some radiation therapist 3 role, a clinical educator role. I really found I had a passion for education. And then went and furthered my own education, did my graduate studies in education and leadership to prepare me for a professional practice role, and then my current role as director for the radiation therapy program at the University of Alberta. I'll have to say the initiative to build from the ground up the Bachelor of Science degree in radiation therapy. It was so heartening to me to have so many professionals come together from various disciplines: medical physics, radiation oncology, radiation therapy, radiology, other areas of the Faculty of Medicine, to the basic sciences, experimental oncology, to come together to put together a robust and rigorous scientific-based education program. I've learned a lot. The support that we've had in putting the program together has been, it's been astounding, really, in a positive way. And we've had support from government, support from the clinical environment. Alberta Health Services Cancer Control Alberta has been very supportive of the clinical practicums that we developed, which is a little bit of a different approach to clinical education. So we tried to build a program that would be forward-looking for the next decade or more. So that takes a little bit of a leap of faith. So I'm really glad that so many people have taken that leap with me. I would say one of the biggest changes in the profession has been the integration of more imaging modalities. So CT, ultrasound, and now MRI really have played an integral part in being able to sculpt and shape our radiation fields to minimize treatment side effects. And that has been very beneficial for patients. We still have a long way to go. And with forward thinking, there has been a lot of professionals who have been involved in making that imaging, those imaging modalities even more sophisticated for radiation therapy. So our new MR Linac that is being developed here in Alberta is, one of those pieces of technology that is really going to change the way we deliver radiation therapy. We'll be able to probably decrease the number of treatments. We'll be able to adapt treatment on the fly as we're treating to ensure that the fields are conforming exactly to that tumor that may be moving around as we, nothing stays static. So I would say that's been the biggest change in our profession. Certainly there are a lot of initiatives that go along with technology. I mentioned the MR integration into radiation therapy, and that's a big at the moment currently, that's the big disruptor, I would say. Also a wonderful innovation. There are prototypes of PET MR linear accelerators that I've seen at an international conference I was at this year. There are a lot of biological predictors of outcomes, predictors of types of treatment that are being looked at. So I believe that radiation therapy is really going to move forward in that direction as well. There's a lot of focus on, as I had mentioned, palliation. So the federal government here in Canada is putting a big emphasis on palliative treatment and palliative care. So obviously, quite a bit of our patient population fall into that realm. And so it really behooves us as practitioners to make sure that we understand all the nuances of what that really means and to have those competencies in order to provide the best possible care for that patient population. As technology becomes more sophisticated and artificial intelligence plays a larger and larger role in what we do, I see definitely that radiation therapists are going to need to be at the table to have to be able to influence the shape that technology will take moving forward. And I think we're starting to see that, especially in the artificial intelligence world. And again, with the focus being on patient and person-focused care and precision medicine, it really behooves our profession to stay and improve and increase our integration into the patient care realm. To be focused on our patient is primary. We have to be patient-centered, and not just to have that on the mission statement of our cancer centers, but to actually embody it and really understand what that means. So I see moving forward into the next decade and beyond that radiation therapists are going to have a more scientific background in order to understand the biological processes, the molecular processes that go into learning more about predictive outcomes. They're going to have more scientific knowledge around interactions with immunotherapy and different chemotherapy agents and how that exacerbates or could exacerbate radiation therapy side effects. So I see education becoming more rigorous, more robust in the scientific way. I see graduate programs are going to be necessary in order to prepare practitioners to take on different roles that we've probably not even envisioned yet. So roles that bring the research from the petri dish or from the bench, the scientific bench, to the treatment couch. And so that translational research, I think, is going to be paramount. We're seeing more and more therapists getting involved in research, and that's very heartening to me. I see that being a very beneficial foray for the profession, and to have some more evidence and further evidence to base our decisions on clinically. So I do see that in the next decade, we are probably going to see practitioners that we didn't even conceptualize today. And that's a good thing. Embrace every opportunity that comes your way. So don't think of your new position as just a job. And don't think of yourself as just an MRT or just a radiation therapist or just an X-ray technologist. Think of yourself as being a professional who has the whole world ahead of them to influence change. It just takes one question to be asked and inquiry into that question, and you've opened up a new door that will benefit your patient. So I just would encourage everyone to, as they start out, to volunteer for your national association, volunteer for your regulatory body or provincial association. Grasp every opportunity that comes your way, and really, with both hands, and think of yourself as a professional and everything that comes with that. Because really there's there's a whole world of opportunity out there for us as radiation therapists and as MRTs, because I think we're just at a tipping point to being included at different tables and in different conversations than we've ever been included in before. And we have to make that happen for ourselves. No one is going to make that space for us. So that would be my advice to someone just starting out. Sometimes people think that there's only one stream or one track that you can take as an MRT. I'd like to suggest that there are multiple streams and multiple tracks. And I see, for example, we have a few PhD prepared practitioners in the province now, and a few more in the country. And I see people forging new paths to new careers that, even 5 years ago, we wouldn't have thought possible. Scientists, clinicians, for example. We have a couple of colleagues in Ontario that have taken on scientist clinician roles. And at first, I didn't even really know what that meant. And delving into it deeper, I think that's just one example of an area where people see a need and they seek to find learning opportunities, whether it's informal education or experiences, being part of a clinical group, and then taking that opportunity and running with it, and really starting to influence the clinical realm and educational realms and the research realms around them to forge new opportunities. And I think I would really encourage people that have that kind of a focus to really run with it and not to be shy about it. And I think our millennials are really well prepared to be able to do that. And so there's a lot of us in this province, in this country, who unfortunately are on the back ends of our careers. And I just think we have a great opportunity to mentor some of the younger MRTs that are starting out to think differently than maybe we thought in our early careers. And, take risks and maybe take opportunities that they wouldn't normally take in their comfort zone, but just to get out of that comfort zone a little bit. One of the other things that I think we're seeing more and more is engaging patients in our committees, in our, for example, in the education realm, we often have a curriculum committee. And so, having a patient as part of that curriculum committee, I think is so beneficial. And part of being patient-focused and person-focused and patient-centered is to hearing what patients value and where patients are coming from. And I'd like to see even more of that. In education, in our program, we've started to seek patient survivors as being part of our program to help shape our learners. So in our clinical simulation semester, for example, we have patient survivors who play an integral role in being our patients, and the feedback that they have for students is so valuable. And it is very heartening to see people who want to give back. And one of the ways in which they can give back is to provide learning opportunities for our new learners who are coming in, for even entry-level practitioners to have that experience in their learning days is extremely beneficial. So I'd like to see more patient engagement and more invitations to patient groups to be part of different areas within our profession. And I think we're starting to move in that direction. I'd like to see it become more robust.